from a family. His mom was a renowned and pioneering obstetrician almost 100 years ago, and coming from that to see his work, and it made her so proud, and now his work is now begat in the great and good works of Dr. Mohan and Dr. Vijay, and I see in the audience so many women and men that have been positively impacted by his works. See, that's immortality, and that's the way to pay it forward. So, and I should probably stop now, because nothing I'm going to say is really all that important after all of that. But here's to that, you guys, and here's to trying to pay it forward and make a difference, because I think all of us in this room owe a debt not only to Vijay and Mohan, but his dad and his grandma and their grandma. And so here's to that. So let's get started, ladies and gentlemen, and I'll try to be quick so you guys can get to lunch, because I know you're all pre-prandial and you're probably very hangry now since you haven't eaten. Does hangry translate in hungry and angry? But it seems to. But we give away all of our slides. If you want any of them, please just email me or ping me. We just ask you to make them better and pay it forward, as we said. How does that sound? So we're going to try to cover the length and breadth of the diabetic foot here, but you've already heard a tour de force in the morning on neuropathy, and then, of course, from the great and good Professor Campbell, who just gave not only the best vascular surgery talk you want to hear, but the best podiatry talk. He's like toe and flow in one package. But what I'm going to talk about actually is nothing very sexy at all. Not that you can really make any of this very sexy, but it's going to be not about tissue repair, wound healing, not about reconstruction, but it's going to be what happens in between and how to maximize time and those ulcer-free days, hospital-free days, activity-rich days, if you will, in between wounds for this patient population. So ladies and gentlemen, this is what I do for a living. I am a toe doctor. I'm just a foot doctor, a toe mechanic, as it were. And you know, oh, by the way, my father, I don't have two generations, I only have one. My father was a foot doctor, and my daughter, our oldest, Alexandria, is going to be a third generation one, so I'm trying to do right by and actually, my old fellow, Lee Rogers, is now her chief. So you see, a personal and professional progeny. But anyway, looking after the foot, I can think of two gifts in tending to the foot, and I think they're both really important. And the first is that in this era of kind of chest thumping and kind of braggadocio and hubris, I can't think of anything that's more of an expression of humility than looking after someone's feet. You know, this crosses all borders. Frankly, I think it probably crosses most religions, and if you think about it, even time. Right? There's nothing that puts you in a position of humility like looking after someone's feet. It doesn't matter what you did before you look at it. It puts you in that